Assalamu alaikum. Now I would like to discuss about graft versus host disease. Okay, in graft versus host disease, it generally develops graft versus host disease. Acute graft versus host disease generally develops symptoms within 100 days. So 100 days. Okay, within 100 days of the transplantation. And in acute graft versus host disease, the symptoms are like rash, which is a maculopapular rash. There may be diarrhea, profuse watery diarrhea. So there may be profuse watery diarrhea, and there may be liver inflammation. There may be liver inflammation. So in acute graft versus host disease, like if somebody has acute myeloid leukemia and he is on transplantation, and then within 100 days there is acute graft versus host disease diagnosed via these features like rash, diarrhea, and liver inflammation. It may be CD8 T cell lymphocyte mediated injury. So acute graft versus host disease is almost entirely mediated by the T cell, and the studies have found that removal of donor T cell almost completely eliminates the graft versus host disease. Almost completely eliminates the graft versus host. Acute graft versus host disease diagnosed via biopsy, colonoscopy with biopsy. After common infections such as there are some infection like in acute graft versus host disease usually happens within 100 days, and there are some organisms that can cause post transplant infection. These are CMV. CMV is the number one cause of CMV is the number one cause of post transplant infection. So this is all about graft versus host disease. Hope you enjoyed.